So I do my external jugular vein cannulation. So make sure scene safety's there, wear my appropriate PPE, gloves, goggles, wash my hands before I start this. I'll gain consent from the patient, make sure they know what I'm about to do to them and that they're happy to deal with the risks. Make sure they're in a position of comfort for me, so not wiggly squiggly. Make sure there's good enough lighting for me to do this job. Make sure all my equipment's there. So appropriate selected cannula for the size of their vein, 10ml syringe, bung, saline solution, alky wipes, and sharps container, of course. So positioning them. They're going to be laying supine, lower body elevated, head down at a little bit of an angle if we can manage it with a stretcher. It prevents embolism and helps the vein pop a little bit for me. I'm going to make sure there's no C-spine injury because it's best if they turn their head away. I'm going to swab. Could you turn your head to the other side, buddy? Yep, great. I'm going to swab the site with alco wipe using a crosswise action. Not touching the side again after this point. Then I'm going to start the procedure. So I'm going to get my cannula out ready, open up all my kit. I'm going to occlude the vein above the clavicle. I'm going to anchor the tissue next to the vein that I'm going to cannulate. Get my sharps canine nice and close. Grab the cannula. I'm going to warn them what I'm going to do. So look, there's going to be a little sting here. So 15 to 30 degrees to the vein is how I'm going to insert this cannula. Get a flash. Then I'm going to advance a further 2 to 3 millimeters into the vein. Hold the cannula steady and advance the needle. Slide the cannula off the needle into the vein. Click it. Then I'm going to occlude the vein. Remove the needle from the cannula. Put it straight into the sharps. Get to my bung and attach it to the end of the cannula. Then I'm going to secure it down with a Turgiderm. Clean the bung with an alco wipe, a fresh alco wipe. Fill up my 10ml syringe with saline. Flush it through. Ensure there's no tissuing, so no swelling and pain at the site, and there's no redness or excessive bleeding I should be concerned about. Monitor it and ensure my labelling's done.